How much do you really know about your heart's health? Naturopathic Dr. Joyce Johnson can boost your heart smarts by setting the record straight on some common myths. Good morning, good to see you.
Good morning. It's great to see you too.
Just the other day, we had a story about Heart and Stroke came out with a report about heart failure on the rise in Canada and Canada's health system falling short in dealing with it, but education is certainly a big part of that. There's a number of myths surrounding heart disease. So can you walk us through many of the common myths and set us straight?
Absolutely. So myth number one is if you have heart disease, you should eat as little fat as possible. And that definitely is not true. You should avoid trans fats that are found in like deep fried foods and packaged processed foods, but you want to have those unsaturated fats that are found in olive oil, in avocados, in some nuts. I have some flax seeds, some walnuts, and also some polyunsaturated fatty acids. So those are your omega-3 fats. So what these do is these help prevent blood clotting to help reduce the risk of stroke, and they also help to lower triglycerides, which is a blood fat that leads potentially to atherosclerosis or hardening of the arteries. So definitely include fat in your diet, but make sure it's the good, healthy kind.
Okay, myth number two, if you have heart disease, you need to take it easy.
Right. So this is definitely a myth. But if you have heart disease, it's really important that you make sure that you have been cleared by your physician that it's okay for you to exercise, but making sure that you're moving your body, you're getting stronger. These types of things are really important for cardiovascular health. So making sure that you continue to be active will help to lower your stress levels, and it will also help to sort of naturally lower your blood pressure over time. So
Okay.
make sure that you are still exercising.
Myth number three, heart disease is really a man's problem.
Right. So we know that heart disease is the leading cause of premature death in women. So, women are really affected by heart disease. And as we reach our menopausal years, this becomes more profound because estrogen being not in our bodies as in the abundance that it was, estrogen is protected. So without estrogen, we have a tendency to have increased fat around our waist, which affects our blood sugar levels and our ability to control our blood sugar, which is a precursor to diabetes. It also results in increase in our bad cholesterol levels and potentially increase in blood pressure. So you want to incorporate, I have some really great foods here that are rich in fiber, also rich in potassium. So we know that these are all healthy things that we need to be eating, a very heart healthy diet, incorporating everything from fruits and vegetables to whole grains. Also like coenzyme Q10. These are foods that are rich in CoQ10, which we also know is important for the proper functioning and health of your heart.
Okay, less than a minute left. Time for one more. Another myth is that it only happens with heart disease is only with older people.
Absolutely not. So this is definitely a myth. While your risk for some heart problems get higher as you age, heart conditions can affect anyone at any age. When you're young, this is the opportunity to change maybe some of your lifestyle habits, to improve your diet, to stop smoking, to start exercising. The choices you make today are going to affect your heart health later on. Not like fine wine, our heart doesn't get better with age. Our heart functioning starts to decrease. So we need to make sure that we are taking care of it today.
Thanks for boosting our heart smarts, and lots more great info on your website and all your socials, which we will link at chh.com. Naturopathic Dr. Joyce Johnson, good to see you.
Thanks so much.